Rebecca, how is Southwest Kansas?
Well, it was really warm yesterday, but then the wind kicked in last night, as it does. And then today it's in the 50s. So like we've gone from, I don't know. And stuff's trying to bloom and some of the farmland's starting to get green and we're just all over the board.
I know. Then we're going to have a hard freeze. And so, yeah,
Yeah.
I hear you. I have a meeting down in Dodge City. I haven't been to Southwest in a while, so I'm really excited to get down to Dodge City in a couple weeks.
Oh, good.
Yeah, it's that whole area I kind of miss. Good morning. Thanks for everybody coming on board, joining us. Having the panel a week late has kind of thrown me off, and I was telling Lindsay earlier that I'm just feel like I'm off my game with the panel this morning. So just glad to be back into a regular cadence. We'll start right at 9. I see Lindsay started the live stream. Mandy, does your tree have eggs or anything for the springtime on it behind you?
Actually, it just has pictures of my kids.
Okay, I didn't know if you decorated, I've seen it differently seasonally, so I didn't know if you've
That's a good idea.
Yeah. We'll continue to let panel members in. All right, well, we will begin. Thanks for joining. Welcome to the Early Childhood Recommendations Panel. My name is Melissa Schoenberger. I serve as the Children's Cabinet Early Childhood Systems Specialist and the chair of the Recommendations Panel. And if we can move forward, thank you. Again, welcome to anybody who's listening through our live stream. Just a reminder, this is a remote meeting, and any panel member who has a question, please raise your hand or use the raise hand function, and we will call on you. And when you do, please state your name and possibly your organization. Now that we've gotten really comfortable with each other, I feel like we're a little complacent with that. But if we could still share our name and our organization, I would appreciate that. And this is an open meetings. The panel does follow the Kansas Open Meetings Act. So meaning we will not be using our chat. So if anybody does pop a question into the chat function, I will ask that you share that with the whole group. So now that we've settled with the rules of the meeting, we'll move on to our agenda. Oh, see, I told you I'm out of practice. This is just a reminder that the recommendations panel, and why are we all here today? What does the recommendations panel serve? The Children's Cabinet serves as the advisory group, the early childhood advisory group for the states. And the recommendations panel is that hand that really guides any questions, action items, really a placeholder for discussion, and really aligns with the All In for Kansas Kids strategic plan. So that's why we're all here, and because everybody serves from the lens of where they work and what they're interested in, and they make up this really rich advisory group. Okay, so today's agenda, we have a very deep agenda of really focusing on that same theme as families. So we're going to stay very family oriented. We're going to do our regular housekeeping items, and then we're going to jump into a presentation by CanLink and K-pop. And we're really, we focused on the first half of our panel meetings with that family theme on, really traditional early childhood themes that we're very familiar with. But the complement to those early childhood themes are our well-being work that's going on in the state. And so our guest speakers are really going to speak to all of those critical support systems for families and children. And then as an advisory group, we're really going to dig into a project that is very important to our state. It's really looking at families and looking at some points of the market analysis. And that's to really look at digging into our subsidy rates in the state of Kansas, which are critical to families being able to and I don't want to say take advantage, but to apply for and have the advantage of having that subsidy benefit. And so really wanting to make sure that as a state, we are getting that analysis correct and looking at the panel to ask some questions. And that's why I sent you those questions in advance. And then we're going to talk about a work group, some systems update, key takeaways, and then we're going to adjourn directly into your work groups. So let's take care of the housekeeping. We're going to approve our March agenda, which was sent out to panel members on Monday. So if I could have somebody who can offer a motion to approve that, I would appreciate it.
This is Tabitha Rossbroy. Oh, Desiree, I'll second it, Desiree. You go ahead.
This is Desiree Straight. I motion that we approve our March agenda.
This is Tabitha Rossbroy. I second it.
All right. And with that motion made, can I have a hands up for everybody who agrees? Okay. And then anybody who disagrees, the same sign. Okay, the motion passes. Let's move to the approval of the January minutes. That takes us back. I feel like we are kind of somewhat living January with the cool temperatures today. So can I have a motion and a second?
This is Christina Small. I move that we approve the January minutes.
Can I have a second, please?
This is Tammy Benham. I second.
Okay, can we vote on that? Thank you. And I think I went through. Anybody disagree? All right. And then what I wanted to share with you, so the motion passes, and let's talk about our summit celebration. I love the summit summary that went out to you guys, and I want to give a token of appreciation to Bree Houston, who is with KU CPPR and who put that together. She did just a fabulous job, and really appreciate the work that Lindsay did with the visual that brought together everybody's headlines and really gave a placeholder of what we want to see in 2036 and all of the goals that all of our guests that day shared. When you see them all together, you have to take a minute to really appreciate that even though every work group is tackling early childhood initiatives from their particular perspective, that we all are really going towards the same end line. And so it really is exemplified in when you look at the sum of everybody's headline. So I personally have this printed out and saved, and it's my desktop screensaver because I just always want to be continuously reminded of where we want to go. Now, we may take some, some back roads every once in a while and some detours, and we might have roadblocks. But we're going to get there. And I just love that we really embrace that activity. And so really hoped everybody enjoyed the summit and the summary that was presented to you. And I'm just going to pause for a minute and see if anybody has anything they'd like to share about the summit. And it could be bad too. So there's always room for improvement. So if there's anything you would like the panel to tackle next year. Okay, well, I just appreciated everybody's participation and thoughtful questions to our guest that day. Lindsay, if we can move on. Okay, so Kansas Open Forum. Really the panel, besides the members, we really do strive to engage anybody who wants to be a part of the panel. So if you're on our live stream, if you are a guest today and you've joined and you have a topic you would like the panel to be aware of, know about, or you just want to share your work, please join us through the Kansas Open Forum comments, and we will invite you to be a part of our work. Well, we have nobody who joined, so we'll move to Kansas in the News, which I am really excited because it's a shout out to current panel members. And CPPR launches Kansas Future Fellows 5th cohort, deepening statewide futures work. And these are panel members who were on, who have been tapped and joined the work in the new cohorts. And then there are panel members that were part of the 4th cohort. And I see Mandy on my screen. So Mandy spent several months deep dive into this work, so she can, she's a good testament of the work that these new panel members are going to join and be challenged into future thinking and what can we do better in our state. So shout out to these 5 members who will be asked very critical questions and hopefully will add a little bit more brightness to our state. So we're going to just dig right into the content. So as we get into the well-being work, you know me, I like to have some type of kickoff to really round out of why we are having this conversation today. And when I attended the governor's conference in Wichita this last fall, I sat in on a panel members session. I sat on Sarah's. And one of the things that Sarah shared that really resonated with me was a short on empathy and really looking at those connections. And when I was, digging deep into to any of my, tricks that I had or anything I've learned from others, because it's, I really enriched myself from learning from panel members and every kind of meeting I attend. That has really stuck with me. And when I was looking at the slides in preparation for today's meeting of our guests, I really wanted to have like a kickoff of why we are doing the work and why we've invited them and what we can learn from them and how we can be better stewards in the early childhood world. So we're going to listen to it. It's like less than 3 minutes. You may have seen it. But I think it really resonates of why we've invited our guests today. So Lindsay, if you want to share it.
Very different than sympathy. Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
And with, I don't think this is perfectly sets the tone for the our first guest speaker today. And I just always, I always have a very emotional reaction when I watch that. And I always, which I think we should, and it just really resonates with me. And with that being said, I am just going to pass it over to our first guest speaker on CanLink and welcome in Megan Cheezick and Jenny
Wow.
Bueller.
Yes. Wow, Melissa, that was a really beautiful video. I have not seen that, and that got me too. I love that. I'm going to share that with my kids. Yes. Hi, everybody. I'm Megan Cheezick. I'm here today with Jenny Welch-Buller from the KU Center for Public Partnerships and Research, and we are very pleased to share a little bit more about the CanLink work that we've been doing about 2.5 years now. So CanLink stands for Kansas Linking Infrastructure for Nurturing Kids. So hence why we call it CanLink. It's just easier. And we try to refrain from word salad, but this one really feels, the whole point of this is connection and linking. So that does really build off of the video. So let's go to the next slide, please. So KU is serving as the evaluator for CanLink and supporting the day-to-day implementation, bringing together our steering committee and members with lived experience. And we do have some of our CanLink steering committee members here today. So of course, feel free to jump in as we talk about this. The Children's Cabinet is the grant lead and serves as of course, the PDG lead. So this work is very much a connection between early childhood and child welfare. And that is why our other partner is the Department for Children and Families. So key connections here, and as well as many community organizations that are participating in our steering committee and contribute to this work. Next slide. So really the goal of CanLink, kind of the way I always boil it down, is we're trying to increase access to early childhood and decrease involvement in child welfare. That's our goal. That's our vision. Of course, that's the aim. The vision is that all families have access to what they need and can thrive in our community. And that really aligns with all of, I think, our visions across the state, and all the work that we're doing is ultimately not that families just get access, but that they are thriving in our communities, and that we are contributing to that. So the work of CanLink is to find opportunities to link families to early childhood services. Where are those kind of where are the doors that we can ensure that it is the right door every time? So our goal is really here to find spaces where we can screen and refer when families need access to early childhood or don't even know that there are services available, and making sure that we're letting folks know, hey, this program, this service, this opportunity that you may or may not be aware of is available to you in your community. And we know that early childhood services serve as a protective factor against child welfare involvement. We know this. We have the research to back it up through our work in Kansas, through ECBG and CBCAP, our community-based child abuse prevention funding, and through Family First. Family First also, over the last 6 years, has demonstrated an incredible ability to keep children out of the child welfare system through the prevention services. So I think the key here is to understand that our work in early childhood is serving as prevention. I often say that prevention is a little bit of a misnomer to me, because it suggests that something is inevitable, that something is going to happen if we don't have this prevention service. Well, let's think about it as like all of the services that we do, whether it's early childhood care and education, mental health, substance use interventions, whatever it looks like in our kind of larger ecosystem is prevention. And so if we're doing our work well and we're ensuring that families are thriving in their communities, then we negate child welfare. We negate the need for that. We decrease it so much that it's only for, the most extreme situations, and that we are meeting the needs of families before it escalates to a crisis. Okay, I've gone on and on. So our goal here is to look at the state level and a local level. And so at a state level, our steering committee is reviewing policies, contracts, opportunities across our systems at a state level, also through the work of our lived experts that are on the team to really help kind of identify those opportunities. And then we're also testing that in local contexts, which we'll go into in a little bit more detail here. Next slide. Thank you. So we wanted to just, the next two slides, just sort of show you how the work of CanLink is directly supporting the goals of the All In for Kansas Kids strategic plan. So you can see here where there's direct alignment under Pillar 1, really focused on these upstream solutions through strengthening the continuum, connecting families, and improving access to care. And then the next pillar focuses on the experiences of children and families. So this is really key to our efforts, that we're looking at this at the state level and the local level, engaging families. We've got our cohort of lived experts. We're really seeking to build awareness about services that are available in many different contexts through this work, and then really seeking to improve child well-being overall through this work. So one way we're doing that, if you want to go to the next slide, Lindsay, we mentioned the lived experts. So this is really what makes it work. They are the heart and soul of CanLink. Our lived experts are amazing, and they do receive a modest stipend, and they meet quarterly, as well as attend all of our monthly steering committee meetings. And our 6 individuals that really, that's a really critical part of it too, is that we've got this cohort of folks. So nobody feels singled out, and that they're bringing different perspectives from early childhood and the child welfare lens. So we've got a kind of a combined group of folks that can really share the different experiences they have, and they provide truly invaluable insight into our work. And they help set the priorities, they help guide the work, and ensure that it's going to resonate with our families. So let's see. I think we can go to the next slide. So the other key part of this work has been partnering at a local level with our family resource centers. So we are piloting some kind of very small scale community-based innovation labs, we're calling them, to test and try out some different ideas. So will these potentially work at a state level, or kind of what is this telling us about even just like baby steps that we can take that can have a pretty profound impact without a lot of resources? So really, we're looking to strengthen referrals and coordination, and we're trying to really co-create those through these safe to fail ideas. So each of the pilots, and Jenny is going to talk about these in more detail, but each of these pilots have worked with lived experts in their communities to identify gaps or potential areas of collaboration and how best to go about that. So Jenny, I will pass it off to you.
Thanks, Megan. Hi, everybody. Jenny Welch-Buller, a research project manager at the Center for Public Partnerships and Research. And Lindsay, I think you can go to the next slide and I'll take it from there. So I am really happy and honored to talk a little bit about that local level work that Megan just referred to. I provide, along with my colleague Maggie Hart, some technical support and guidance, meet regularly with our 5 Family Resource Center pilots and to walk through identifying, developing, tweaking these local level pilots. So over the last few years, the ideas that have emerged at the local level fall into about 3 buckets right now, but we're ever continuing to always continuously talking and working on new ideas that emerge from lessons learned. So the buckets you see here are health insurance navigation, screening, and referrals, and I'll share a bit more about that example in a minute. And then also identifying opportunities to connect more families by working with local health systems, hospitals, and clinics. And then another bucket, so to speak, would be working, connecting, developing, screening, and referral partnerships with school districts. So those are our basic 3 buckets that have emerged so far. And I'd love to dive a little deeper into some examples. So we're working closely with Pony Express Partnership for Children. They have developed a couple of ideas. One just recently emerged, and the initial idea though was to develop a referral partnership with the school districts. And so the first one is Marysville. And so here in this situation, they developed a form in which they can identify families via the school's social worker and support staff, and then connect with Pony Express FRC to ensure that they are connecting with other early childhood care and education resources in the community, and in many cases, concrete supports they continue to identify as a need. So that is in motion, and they are collecting data on that. One thing that emerged rather organically with Pony Express, and we're really excited about, is a family-led outreach advisory council. So a family who had received services and got connected through Pony approached Pony Express and said, you know what, we feel like we were really helped and we want to connect other families. And so the grew and emerged into a group of folks who meet regularly now, and through the FRC are getting support, but then also connecting those families who may not have access services they may not be familiar with the ecosystem at all, or they may be new to the community. Pony Express talks about how strong their network of community partners is. And so a lot of families are connected, But those who are a little harder to reach, maybe not as familiar with the system, that's what this Family-Led Outreach Advisory Council is here for. So, oh, I see it feedback in the comments. I love it. And I'm very excited to learn more. And so we're looking at these two tracks, these two linkages or pathways in gathering and data. And one of the really neat things Pony Express is interested in doing, Brandy, if you know her, is also teaching or training some of the family members in that advisory board to track the data as well. And so there's like a skill building opportunity embedded there as well.
Jenny,
So
I just want to
yeah.
add really quick
Mhm.
onto that. From all the kind of story collection, Our Tomorrow's work we've done over the years, we've noticed there is definitely people are frequently more likely to, not necessarily more likely, but there tend to be a lot of stories clustered around trust with family and friends, and seeking services and connecting to services when they hear about it or are connected through family and friends. And I think this idea that Pony Express is testing out really reinforces that idea. And it's a great opportunity to take a look at, does that help us reach in a very intentional way? Does it help us reach more families that would be less likely to approach Pony Express or XYZ organization otherwise?
Exactly. Thanks, Megan, for making that connection. 100%. All right, next slide. So Turner USD is working on, they were one of the first ones to launch their pilot several months ago, and that is establishing a screening and referral process with the schools in the system. And also, so I'm adding a question that asks if you have children under 5, and then partnering with the school district to get a list of contacts to then do outreach to. And so they've been working on that for a while. One of the things that just emerged in the last couple of weeks was a new idea on how to boost some of the connections via this new partnership and referral pathway, and that is by partnering with the school texting system. And so that's kind of exciting development because Ashley Turner has talked about how that's been successful with their Parents as Teachers program using texting, and she knows her community, and so wants to give that a try. And so I didn't even have a chance to put that on the slide. It's such fresh news, but it's just a really strong partnership with the school district, and they're excited to continue to test the workflow. So and that's something I want to mention too. These are all hopefully opportunities that will share lessons learned, what worked, what didn't work. And so all of these FRCs are diligently tracking all these lessons learned, and we're hoping to then share even the steps. We call them workflows. 1, 2, 3, 4, 5. What were the steps? What were the connections plus lessons learned when developing these new partnerships? So very excited about that. Next slide. And Lindsay, please do tell me if we're hitting up on time. I want to make sure I honor your time. LiveWell Northwest Kansas. So they are working on screening families with children under age 5. Oh, do you all see a big black? Okay, we're good. For early childhood care and education needs during the insurance navigation appointments. So they have a service in which there's insurance navigator who works with families to help sign them up for insurance and screen for their other needs. And they noticed that one of their insurance navigators was identifying a lot of families with other needs who couldn't help but say, you know what, I'm going to connect you to other services. And so we thought, how can we bottle this? How can we formalize it? How can we build on that strength of that individual insurance navigator? And so they are documenting this process, formalizing it, and trying to make sure that there's as many opportunities as possible for whenever people are through this portal, so to speak, through this engagement, made aware of other resources in their community through the FRC that they could connect with. So that's really exciting as well. And one thing that's emerged recently is this idea of self-referral opportunities. Sometimes if it doesn't click right away and maybe a connection isn't made to another early childhood service, then they can have a flyer with a UPC code that says, you know what, maybe when I get home, I'm going to scan this and sign up and say, please call me, or I'd like to refer myself to a organization in their community. So, oh, thanks. I see we're good on time. All right, perfect. Great. So Live Well Northwest Kansas is ever tweaking in the idea, and that's what's so exciting too, is the creative freedom and ability to say, hey, this is working, this is not working, let's tweak it, let's try something new. And so that's another exciting element of our FRC pilots. Next slide, please. I think. Perfect, thank you. So the Community Children's Center, this serves Douglas County, and some of you may be familiar with their work. So they developed a partnership with Lawrence Memorial Hospital. I've been there many times. Sorry about that typo. They're starting with the labor and delivery department, and then hoping that a partnership, a referral screening, thank you, a screening and referral partnership there will grow and expand to other departments in the hospital. But the labor and delivery pathway is the one we're piloting first. And so they developed some flyers with coupons. Say, come visit us. They have a resource clothing closet. They have all kinds of resources, and it's a beautiful new location or remodeled site. And so they're going to track how many come in through that mechanism. There's also a self-referral possibility there. And if families are interested after delivery in connecting with FRC, they'll also do home visits if they're not able to come in. So that's all on the flyer. And then an aside, FRCs can't help themselves. Once they got going with these workflows, they wanted to just keep exploring where else can we try these new connection points. And so Mi Apoyo Prenatal is a Douglas County family support program that they're also working with. And so they're trying to compare, what does it mean to make these new connections and partnerships at the postnatal, like that, you're overwhelmed, you get a big folder, how many folks will come in, versus a prenatal, like this program that's serving folks before birth, and their ability to make connections to the FRC and other services prenatal. So they're trying 2 different pilot pathways to explore what the differences are there and what they can learn. All right, next slide. Kansas Children's Service League is partnering with KU Wichita Pediatrics, really exciting partnership. We've had many meetings there, and they developed a flyer with family council input. And then again, all of these FRCs are doing, as Megan alluded to, working with their lived experts, people in the community, families, to make sure that they're identifying the right needs. They're designing flyers and steps that make sense to families. So they developed a UPC code for self-referral and outreach, and then also the pediatricians will, at the 1-month appointment, will make sure they reference KCSL's FRC. And there's a real focus on concrete supports, because through this partnership, they've identified that's the need in the community. That's going to be one of the first things that they're seeing a lot is parent supports for concrete needs, diapers, connections to food assistance, but then also parent education services. So they're excited to try this out. They're also going to develop a big poster for the waiting room, and they want to make it a really warm, inviting opportunity to connect families to their FRC for that wraparound support. So, all right, next slide. So we would love to, I know that's a lot of ideas and information. Hopefully some of it clicked for you. Maybe it resonates. Maybe it's happening in your community, or maybe it's an idea that you think, maybe we should try this in our community. We don't have that idea yet. So I'd love to hear what really stood out to you. And also, do you have a sense of possibilities of scaling these models? Of course, we're still learning what works, right? We're gathering data on that. We also would love to hear from you and your expertise on what might it be helpful to leave behind for the broader ECE ecosystem when it comes to engaging families with experience navigating systems. So that lived expert piece, but also these local pilots. So if we do still have time, I did develop a little Mentimeter. I don't know if any of you have done that before. It can be kind of a fun way to share and expand ideas. And oh, thank you, Lindsay. You're the best. Lindsay shared the link. So if you're interested in trying out this tool, you can click on that link, and I will share my screen in a minute, and we can look at our responses live. Of course, I also am very much open and welcome to folks just coming off mute and sharing their input too, or popping it in the chat, whatever method is most comfortable for you. So Lindsay, I am going to share my screen now and see what we got. Okay. Just a second. And
Well, that's
there we go.
uploading, Jenny or Megan.
Mhm.
I had the ability to participate in a meeting this week, and well, I missed it, but I did get all the notes. There was an FRC overview to the state home visiting leadership team. And one of the pieces that I was really fascinated with the report that we were given was the quarterly service output report from October to December. And, the breakdown of the it was the concrete supports, it was the family services, the events, and the external referrals, and just the breadth of that every engagement that families were left with at least almost 2 resources, and what that looked like, and the list, just really how powerful that work is, and making connections, and the different items, and just where we are, going back to that empathy, and the resources left were just simple, like household and hygiene items. That families, we think about really critical items, and then there are moments that our families are just needing basic support. And what does that look like? And so that really was powerful, and I saw that on your report and wanted to see if you had anything you wanted to share further. And I will probably send this out with our notes, because I think it really tells a different snapshot and more of a breakdown. So Megan, I was just curious what you had to add to that.
Yeah, I think that is a really great illustration of the work that the family resource centers are doing from a quantitative standpoint. And I think the kind of behind the scenes of that is you may come in for some clothes or food pantry or a referral somewhere, and it may feel like a one and done situation. But if that person feels welcome and safe, and that they've received that empathy from the family resource center, which we know is happening, then that person is more likely to come back and feel safe, building those trusting relationships and deepening that trust, so that when they're ready to share more, or they need something again, or their friend is in need, then they feel more comfortable coming in. So it doesn't have to be that the FRC is the be all end all spot. Like, it doesn't have to offer everything. But I think if somebody says, come on in, I got you, I'm going to take care of you, then that is all that matters. There's somebody that says you're not alone, and I'm going to come alongside you.
I'm just going to jump in here.
Yeah.
I'm Tammy Benham with Southeast Kansas Library System. And I love what you just said, Megan, about someone being welcoming and coming in and saying, come in and I've got you. We're seeing a lot of this in the public libraries, and a lot of especially in the very small rural communities that are establishing food pantries and providing some of those concrete supports as well. And it's expanding and growing based on need and what's happening within the economy. And so I would really encourage the FRCs that are existing to, if they don't already have a strong relationship with their public libraries, or build a strong relationship, because part of that we do offer is the opportunity for social connection, which is another protective factor and something that the libraries are really good at offering as well. And becoming one of the places where they're referred to would be awesome. And also just strengthening that relationship in any way that they can in these small and rural communities, especially, would be beneficial for children and families. So thank you so much for bringing that.
I love that. On it. I can't wait to meet with them again. I have a few coming up next week, so we'll pass that idea along. Fantastic. All
So
right.
Megan or Jenny,
Yeah.
on that,
Oh,
oh, Jenny, I'll let you do your activity and then I'll end up with, I have a question at
sure.
the end, but let's do our mentee activity.
Okay, yeah. Well, you all were excellent. You look like pros at this. So it looks like the school partnership, the texting outreach has the most interest so far. So, and then pediatrics comes after that. And now we've got a new idea, library. So really helpful to see how these resonate with you. And I think all of this will form what we write, our findings and what we share with the state when we've learned it all. So I did want to see too. I know we probably are running up against time. If you think of ways that these models could scale in other areas of the state, we'd love to hear that. We're going to take this feedback too, so back to us. So if you don't have time to get all your thoughts and ideas in now, you'll have this link with you, and I can keep it live, so we'll have your thoughts to reflect on later. So. Um, and then our next question would be, what learnings or knowledge would be helpful to leave behind for the ecosystem when it comes to engaging families in this work? So those are our remaining ideas, but I did want to make sure that we do, since y'all have such rich ideas to share, that we just open it up, like you said, Melissa, for conversation. So I can stop sharing my screen for now.
No, that was exactly where I was going to lead to is, I think when I look at the makeup of the panel, I'm gonna pick on you for a minute, Abdul, because we were in a meeting together this week, and Abdul was discussing the mental needs of his own staff, of his own workforce. And so we represent, workforce, families, agencies that are providing support. The panel is rich in all of that, and just trying to think of connection points. If if Abdul's, workers needed their workforce in their early childhood setting, and then that translates to what do families need and having those tools. And so yeah, perfect. Actually was thinking right on how can we make these natural connections? What do we do to support them if they're in our areas? And you're right, Jenny, how do we get them this idea and concept if you don't have a formal one? What does it look like in communities to begin the network of an FRC, even if you don't have the formal funding? And how does that outreach work? Because I think I saw in one of your slides, Megan, when you're speaking, it was the upstream. I mean, that is the piece that if we're doing it successful, we never see the impacts are just there. So I'm going to leave that to the panel to continue adding to the mentee. But wanted to throw it back to you and Jenny and Megan, if what thoughts come up to your mind with those questions I just asked.
Well, I can start just as we're thinking through that, just by sharing some of the results. You all are, what a group. It's great. I think we're going to need to come back and share and get some more input as we continue to learn more. So, um, yeah, I think that it's just this feedback loop, right? Like, what are we learning? What can we improve upon? How can we continue to thread? It's always going to take diligence and ongoing effort, right? Creating one process, but then making sure we're revisiting all of those uh, over time so that they continue to stick and pass on through our efforts at all levels. So yeah, these are great.
These are great ideas.
I think I saw a hand. It may or may not still be
Oh.
relevant, but Tabitha.
Oh,
Yeah, I did have a hand up. If somebody says you can talk, I'm like, well, I have something to say. Um, I just like every time I think about people doing work in their community, I think it's so wonderful. Like, and if I wasn't on this panel, I think would I have the opportunity to learn about it? And so I'm just really grateful for this experience and to get to bring back what I learned to my community. But just one thing I keep thinking about that resonated with me in this presentation was involving people whose voices are not often heard, right? I think as helpers and champions, we get into this practice of, okay, we want to help people. We want to do this. Here's what we see the need is, but we don't often look around our room and think, are the people that we want to help even represented here? Do they have a voice in this? Are we speaking for them? Right? So I really love that you guys, have called that out and are looking for ways to change that. But I think that's something that all of us need to keep in mind in all of the work that we're doing and all of the great things that we hear is, are we actually involving and getting feedback from the people who need help?
Yeah, this is Megan Cheezick again. I love that, Tabitha. I think that that co-design piece, that partnership is really critical. We've learned some really important things and made pivots in many different projects as a result of, if something gets ideated in a vacuum, you're gonna run into some problems. And so I think even if you have created something and you've implemented it, there is no reason not to take a step back and really think through, like, what should this look like? How, even language, like as we think through like different we're developing kind of a child development training for child welfare staff through this project as well. And so we're thinking about like scripts that might be helpful to like CPS staff that they could, use with families. Well, the families need to help create that. They need to say like, this is what would not offend me, or this is what would actually engage me, as opposed to us just making it up, right?
Yeah.
This is where that co-creation is so critical, so that when we're recommending language for people to use with families, that it actually will resonate with families.
Mhm.
Well, I
Absolutely.
think that is a great resonating thought to leave with. And what we are co-creating for families, that unless we have the family at the table, we are not doing our job. And so I just want to thank Megan and Jenny for joining us. And I do have the privilege of being a part of CanLink. Not always does my schedule allow, but when I'm there, I always get super excited and love the work that we're doing, because I do believe that they are going to be long-lasting impacts on families in Kansas. And so I hope you all continue. I think I heard Jenny say we'll keep the survey open for just a little bit. If you think of a great idea later on this afternoon, like I wish I would have shared, and if you want to pass on that information to Lindsay and I, we will make sure and connect it with Jenny and Megan also. So really appreciate you two joining us this morning, and it just always a powerful message. Thank you, guys. All right, and we are going to transition to our next presentation on the same theme of well-being from a different lens and a different framework. So it is my pleasure to welcome K-pop, Kansas Power of the Positive. I just like saying their name, K-pop. It's kind of, am I going to be in front of a music group, or am I going to be talking to, early childhood leaders? So you just never know. And want to welcome Vanessa and Sophia, who will be presenting this morning.
Thank you so much. We are excited to be here. And Megan and Jenny, what a fantastic presentation. We are excited about all the cool things you've got going on over there at CanLink. So we just wanted to start with saying we are so excited that you're taking some time to let us talk to you today about our efforts. And we're excited to work on seeing where our efforts align and hope that we can find ways to keep working together. So I'm Vanessa Eberly. I'm the program manager for Essentials for Childhood, and I'm here with my colleague Sophia Ringring, who serves as the epidemiologist in the Injury and Violence Prevention section at KDHE. So we did mention K-pop, and that stands for the Kansas Power of the Positive. And that is a statewide coalition of organizations who have a shared vision that all Kansas children live in safe, stable, nurturing relationships and environments. So looking at the 3 pillars that you've put together, we can see how these weave together beautifully with the relationships and the environments and the stability. This coalition's been running for 12 years. And it continues to do this important work. We've got over 90 members coming from 50 diverse agencies, and we're always looking to reach more families. Because of K-pop's hard work, KDHE was able to apply for funding from the CDC. So Kansas is one of only 12 states or tribal nations that receives the funding through Essentials for Childhood Cooperative Agreement. So sometimes through this conversation, I'll probably say Essentials and sometimes I'll say K-pop. K-pop's the coalition, Essentials is the funding mechanism. So sometimes it sounds a little complicated. We're just gonna call it all the same thing. So to accomplish that vision, we work on reducing adverse childhood experiences and promoting positive childhood experiences. And we do that by using evidence-based strategies, and we are very focused on that upstream prevention approach that I loved hearing about a minute ago. I'm glad we're all on the same page with that. So K-pop recognizes the incredible power that comes when we focus on the positive, hence the power of the positive part. So we incorporate the Montana Institute's core assumption that the positive is real and it is worth growing in ourselves, in our families, in our workplaces, and our communities. Next slide, please. Thanks. So I would imagine that many in this audience are familiar with ACEs, or adverse childhood experiences, so I'm not going to spend a lot of time explaining that. But I did want to share these images and concepts from the CDC's training regarding ACEs and PCEs on the Veto Violence website. I like how it helps us wrap our head around the different aspects that impact children development. Children come with their potential, but what they experience during their lifetime definitely impacts that. So when we've got the adverse childhood experiences, it kind of chokes them out a little bit there. Makes it a little harder to achieve their full potential. Could you move to the next slide, please? Though many children experience thorns and challenges, as a society, we can work to create a garden with plenty of nutrient-rich soil, water, and sunlight. So I share this with you to highlight why we've chosen the prevention strategies that we have. We recognize that children do not exist in a vacuum, that this is a lifespan and social issue, and it ties directly to your pillars as we work to create the best world for these children. Next slide, please. So in order to achieve our vision of those safe, stable, nurturing relationships and environments, we utilize 3 strategies. Those being promoting positive childhood, got stuck on K-pop. Promoting family-friendly workplaces, changing social norms to promote social connectedness, and gathering and analyzing data to guide our efforts. We'll be discussing each of these in greater depth throughout the presentation. I think you'll see how easily aligned we are with the recommendation panel pillars. I would encourage you to look for the places of overlap and where collaboration would be appropriate as we keep going. Okay, next slide, please. So the CDC Essentials for Childhood program has a menu of evidence-based options. The first strategy we'll talk about is strengthening economic supports to families, and in order to achieve this, we selected family-friendly workplace policies as our area of focus. All right, next slide. So K-pop's work group, their first major project was to develop an employer survey. So the Wichita State University Community Engagement Institute, they beta tested a survey with 6 employers utilizing the work group members to secure employers and then debrief them following their completion of the survey. And things have really grown since that time. Next slide, please. So go ahead and take a minute to look at this slide. Look at all those awesome benefits that we have outlined for the employers. When we approach a business, we try to help them see how beneficial making family-friendly workplace policies is to them. And there are plenty of benefits. Also, I want to point out that it's not just parents that benefit from these things. When you have things like flexible work schedules, everybody benefits from being able to get to a doctor's appointment. Those aren't specific to just caregivers. Okay, next slide, please. On the other side, children and families also benefit. So caregivers who feel that they're supported at work will have lower levels of stress. And caregivers who are less stressed are in a better situation to give good care. Thus, we come back around to our safe, stable, nurturing relationships and environments, and we are reducing those ACEs and promoting those PCEs, or positive childhood experiences. All right, next slide, please. And here I'm going to turn it over to Sophia to tell you a little bit more.
So my role in K-pop is mainly supporting the data and evaluation needs of the state coalition, and then trying to assess the impact of our grant strategies. And when it comes to family-friendly workplaces, so here is an example of an online report that employers get after they administer the survey. So employees are asked about the 19 family-friendly workplace conditions, kind of in two parts. So first, how important they are for their ability to provide or care for their children at home. And then kind of on the back end, how they would actually rate their workplace in providing this condition, which ultimately allows us to see where the gaps are, kind of in those color-coded columns. So let's say their staff says one of the conditions is important, but the workplace rating of it is poor. Then we know there's a gap, and that condition is going to be a priority area for improvement, which is really helpful for employers to see, just so they know where to start based on the needs of their employees. Because there's 19 different conditions, so you can't just do everything at once. But from there, ideally, workplaces select conditions to work on based on those gaps and what they would like to receive resources for. I also think it's important to point out that the survey doesn't just focus on what workplaces are doing wrong, because some workplaces across the state are doing really great things when it comes to supporting working parents. So this can also be an opportunity to showcase or highlight that. And then if a workplace is rated by their employees as excellent in certain conditions, then that workplace can also sign up to be a peer mentor for others, which is really great, especially when you know a business is struggling to make an improvement, because there's only so many resources and kind of pieces of paper you can provide. But getting them connected with another employer who is doing well in that area seems to be more impactful sometimes. Next. And we do need to add a few more stars to this map, but this shows our participating employers in the survey so far. So we've had about 40 Kansas workplaces take it, represented by the stars. And initially, when we prioritized regions in the state, we looked at those with the highest adverse childhood experience scores, according to the Burfus survey. And those are also highlighted as on the map, just as a starting point for areas that would be kind of most impactful. And then the employee reach is even further. I think we're at over 3,200 Kansas employees taking the survey so far, since we initially started this campaign, I believe back in 2020. Next. These are the 8 areas of the family-friendly workplace policies that we focus on. So all 19 of the conditions that we ask about in the survey are going to fall into one of these areas. And grouping them like this mainly just helps us better make sense of the survey findings, and then share it with partners just on how we're doing in each area. But based on the responses that we've gotten so far, We know just from findings that out of these conditions, a livable wage and a flexible work schedule are the two most important conditions according to employees and working parents to provide those conditions for their children. And then we also know, based on the workplace ratings, that a priority area for improvement is childcare access, because a lot of, well, the most poorly rated workplace policies, according to those employees, they tend to focus around childcare, the top being subsidized childcare costs, which I think we had about 40% of working parents rating that as poor, followed by on-site childcare. And then the other area that we often see rated kind of second lowest is going to be the supportive services and resources, which is going to include a lot of the supports. So the access to parent education, or even something just as simple as an employer-sponsored family event that they offer. Next. Yeah, but with our family-friendly workplace efforts, we have seen 28 policy changes implemented by employers. We typically, right now, follow up about 6 months after the survey is completed, and those resources are provided, just to check in and see how things are going. And then based on those policy changes and the total number of employees at each business, so the estimated impact is that about 12,000 employees have been impacted by some kind of outcome after the survey. And they now have access to at least one more family-friendly workplace policy than they did previous, before they got involved in these efforts. But out of these policy changes, so the most commonly implemented were telework options, access to parent support, and then breastfeeding support or rooms available at businesses. And then something else that was cool is as we've kind of been doing this for a few years, and as we get more and more employees that have taken the survey, is we've been able to apply an equity lens to the survey results and look specifically at the different needs of different employees. So whether it be across demographic groups, maybe single or married working parents, those living in different areas of the state, or even across different industries. And from there, what we've seen is that there are certain groups that are less likely to access family-friendly benefits than others. And some of those are going to include hourly or low-wage workers as compared to those on salary, mothers living in rural areas of the state, and then women working in the manufacturing industry. And those are just a couple of the top ones we noticed. And we do acknowledge that some of these policies aren't going to be feasible in every occupation. So telework isn't going to be possible for everyone, or the ability to bring your baby into the office for the first 6 months of life. But we can and should kind of continue to strive to expand and improve support wherever possible, and from which condition that an employer wants to make an improvement on. Next.
And with that, if a business goes ahead and they participate and they make some changes, then soon we're going to have a family-friendly workplace designation status that they can have. So we'll be able to, they'll have a sticker that they can put on the door. There's a banner that they can use. So we're very excited to be able to start sharing that soon. So we're looking at starting that in late spring, early summer. We hope to be starting to award those family-friendly workplace designations to businesses that have taken the survey and have made those changes. So keep an eye out for that. It's very exciting. And also think about businesses you think might be a good fit, or possibly what policy changes could be made where you are. Next slide,
Vanessa,
please.
And Sophia, I have a question. If we could go back to the previous slide. And I apologize, I wanted to come off mute and I accidentally was going to start drawing all over your slides. I almost hit the illustration. So I have to watch what tools I hit. I have a question. When you say you go back and at the 6 month mark and you resurvey, are you looking at satisfaction of the employees and looking at, like what system change are you wanting to see and note at that 6 month mark to see if it was just implemented or the benefit that it has to the overall well-being of the employee?
Yeah, so it's not so much of like a resurvey as we get back in contact with the employers that have had selected conditions for improvement that they wanted to work on. And we check back in and see their progress. So if they have kind of initiated some work towards a family-friendly workplace condition, or if they have implemented one, but we also see kind of what areas they struggle with as well and may need additional support for. And we've also noted kind of a little bit of a challenge in this as well. So like 6 months kind of flies by pretty quick. And some of these policy changes are large. So we're also implementing like a year follow-up as well, just to kind of capture more of these policy changes. And kind of another barrier we've seen is just employee turnover, especially in kind of like the HR management side. So the person that we talked to 6 months prior, when they were initially kind of all excited about making their workplace friendly, they might not be there. So getting in contact with the right person who knows what we're talking about and just kind of keeping the ball rolling is a full-time job in and of itself, making those connections. But the 6 month survey is mainly to see how the employer thought about the initial survey that took place with their employees, kind of if they have anything to report on from the resources that we've shared, and just to see how we can better support them when they make the policy change and where they're at in the process.
So is there any room in the work that does recheck the pulse of those receiving the benefits of the policy, like the employees?
We have had some employers we've kind of resurveyed their employees a couple years later. So we've been doing this about 6 years now. So there have been a couple of businesses that have made those bigger policy changes that have asked us to come back in and then kind of reshare out that initial survey to see the progress, which I'm all for doing. From an evaluation standpoint, like a pre and post test, great. That's how I can 100% say that this had made that improvement in the knowledge gained. But the likelihood of an employer wanting to email out their employees a survey link again is fairly low. So as much as I would love it, it's not likely, unfortunately, although we do in a few different situations have employers who have made positive changes want us to come back, which I do love to see.
Well, I appreciate you indulging my questions because, just trying to see the overall impact of employee satisfaction, I think is important, and well-being. So I appreciate that. We can move them back ahead, Lindsay. Thank you.
No, I appreciate questions then and there while it's on my mind, so I don't have to circle back.
Perfect. Thank you. We are going to jump back to that menu that the CDC had provided. Our second strategy is to change social norms to support parents and positive parenting. We aim to do this by public engagement and education campaigns. Next slide, please. So in 2000, and I just want to pause for a second and acknowledge that I have loved this meeting up to this point, the focus on connection and empathy, and it made my heart so happy when I think about the work that we're doing over here, and I'm excited to share it with you. So in 2023, the U.S. Surgeon General named social isolation and loneliness as a top priority. The report highlighted the health implications for lacking social connections. So if we think about positive childhood experiences, many of them essentially just boil down to connectedness. So feeling connected to your family, to your peers, to a caring adult, to the community, to the school. Connections make a huge impact. That's why we're working so hard to bring higher rates of social connectedness in Kansas. And we definitely see some overlap with Pillar 3 here with the experience of of children and families. Next slide, please. So one of the ways that we were working on promoting social connectedness was that last year we ran a social media campaign that was very successful. It actually resulted in a surprising 15 million impressions. Our comms team was stunned by how well it actually went. Apparently, the message of social connection is really resonating. So we're going to be running the campaign again this year. We used both unpaid or organic and paid social media to spread the word about social connections. KDHE regularly shares the organic posts, and we're also running prioritized ads on Facebook and Instagram, and these are aimed at caregivers between the age of 18 and 50. These posts are built using the Montana Institute's framework, which I mentioned earlier when they talked about the positive and how we need to highlight that. So it focuses on shifting social norms in a healthy direction. So most of the posts include positive statistics to emphasize the positive norms that are already going on around us. So I realize you probably can't read all of those social media posts, but they're very focused. Well, I don't know if they have the stats in those little blurbs, but if you were to actually see the post online, it would say something like this percentage of families eat dinner together regularly, or this percentage of children have someone read to them regularly. So instead of doing the fearing side of advertising, we're really focusing on the positives that already exist. All right, next slide, please. And further emphasizing the importance of connections, we actively hold training sessions, just like your pillar 2. It fits beautifully in here, working to develop the workforce. So Connections Matter is a community initiative to promote connections. And these trainings are about the importance of connections on brain development, especially in young children. But it also talks about how it really helps everybody. HOPE stands for Healthy Outcomes from Positive Experiences, and it's a framework from the Tufts Medical Center. They've been working closely with the CDC to understand the impacts of positive childhood experiences on children and how to create more opportunities for everyone to have those experiences. We have multiple members on our team that are trained facilitators for both Connections Matter and HOPE. And we have a HOPE champion who can do additional technical assistance for any organization that would like to make adjustments in how they function. And this really, when we talk about trauma informed, like these two are really, really big on that. So if you think that's a thing that would be helpful to your organization, feel free to reach out. We would be happy to run some trainings for you. All right, next slide, please.
This is just to further reflect that the work we do is supported by a data to action grant. So 2 out of our 3 goals for the coalition are data related, with our prevention strategies that Vanessa has been going over kind of sandwiched in between. So the first goal, improving data collection, largely focuses on youth data and the Youth Risk Behavior Survey. And then the third goal is going to be the data to action activities, which is really seeing the follow through of data sharing and it extending kind of all the way to decision making and community action, which is what I think, just from an evaluation standpoint, is one of the hardest things to measure. So that initial kind of what you found and then how it makes an impact in your community. But a lot of the work we do in this area does involve getting data into the hands of the right people. So there's a lot of communication that we have with local child abuse prevention coalitions and our efforts. We've developed a policy brief to hopefully translate this information to legislators. And another activity in this we've been working on is kind of our data walk roadshow that kicked off last year. So you can see it in the top right picture, but we have a couple sets of posters featuring different data points from ACEs, PCEs, childcare to breastfeeding, And these posters are available for local organizations to rent or check out and then put up in their own communities, which has been pretty fun just to see the posters kind of make their way across the state. Next. Yeah, and with the first goal, we do a lot of education around the importance of youth data and its current challenges. So a lot of the time what we're seeing is that decisions about youth are made without directly hearing from them. But if we really want to support them effectively, we need reliable data, and the youth surveys are one of kind of the more important tools for capturing that. But at the same time, we are seeing a decline in youth survey participation across the state. So not just in student participation, but also in the schools that are willing to participate and deploy the surveys as well, which is a growing challenge that we face. A big part of this is going to be just related to legislative barriers that restrict kind of the non-academic surveys, especially since we've gone from an opt-out to an opt-in system. And further restrictions on the timelines when surveys can be administered. But a lot of this is outlined in our policy brief as well, and kind of remains an area for improvement as we move forward. Kind of go, oh, next slide, please. I can go over this one fairly quick. But some of the data that we do have related to positive childhood experiences was featured in an article by Hope in the National Resource Center. It was really one of the first, we were one of the first 4 states to add the PC module to BRFIS. So that's kind of why we were included in the preliminary findings. But this is one of the first articles that was able to tie the economic impact of PCEs, which if you're kind of talking to policymakers, a lot of times people want to see kind of the dollar amount saved. And a large proportion of that dollar amount is going to come from the increase in life expectancy that's associated with increased positive childhood experiences. And we're hoping, so the ACE and PCE modules aren't asked in BRFIS every year. So it always depends on justification and of course funding, but we're hopeful to get these modules back in BRFIS 2027. And then I'll let Vanessa do the last slide.
Sounds good. So we want to acknowledge your time. We're grateful that we're able to be here. We would love if you wanted to come get connected and participate. Here are some of our suggestions for ways that you could personally get involved. You could host a data walk. You could check out the family-friendly workplace stuff. Maybe there's a business that you can think of that would really benefit. You could share that policy brief. You could join K-pop. You could take some of those trainings or share our social media. So we would love, we do also have a community health workers learning module that is free and available to anyone if you are interested. Go ahead to the next slide. And we are just so grateful for the opportunity that we had to come and to participate. And we are really grateful for all the hard work that you are doing to help Kansas children and their families. Thank you.
Thank you, Vanessa and Sophia. I just wanted to take a moment and see if any panel members had any questions, any reactions for our speakers.
I'll say something again. This is Tabitha Rossbroy. I live in Winfield, and our Legacy Regional Community Foundation, who I work a lot with, does a data walk. And I really don't know. It seems like they must work with you guys or do something. It's very similar. And it's been really powerful in our community. And one thing that they do is they've taken it to the local high schools and they do a data walk once a year. And then students, and maybe even in middle school too, do like a poster presentation of these issues going on in our community. So it's just been this really great intergenerational way of helping our community figure out what its needs are.
Is that
so Tabitha, I love that.
It's someone, yeah, it's awesome.
Vanessa.
Go ahead, Sophia.
Oh no, I was gonna say, is that Teresa Wood with the
Yasmin.
Yasmin would. Okay, we
Yeah.
actually, she actually we reached out to her because we saw them featured in a couple articles, and she was really great in providing us kind of resources for how they got started. So I like how you said that because we did kind of go to them for some inspiration, and she had a lot of positive things to say.
Okay, that's so funny. I was like, this is really similar work. Anyway, I think it's great what you're doing, and it's been really powerful in our community, and I'm excited to see how else we can like hook into this.
So Tabitha, I think lesson learned is that not all initiatives start from the top down, that the state agencies and programs have a lot to learn from local. And so appreciate that frame. And then to tag back on to the CAN link, when you look at the YRSB, the data there, that's the upstream and what we're doing here in the early childhood world. And then being able to look at what is that impact with our older students in Kansas is just a powerful tool that we should not forget. That's a way to understand that those early investments and the impact they have to students later on in life. Well, I thank Vanessa and Sophia joining us, and that was a really good way to end, and we will now segue into our last group joining us, which is really going to be an interactive session with our advisory group, because this is why the recommendation panel exists. It takes me back to when we had conversations with the Department of Education as they were looking for a new commissioner. Like, this is why we do our work, and really to give feedback and investments. So that being said, we have our next 20 minutes with a support group that is working with the state to really look at our market rates. And I'm going to hand it over to Ivy and Megan.
Morning. Thank you, Melissa. Yeah, my name is Megan Smith, and I am with the Public Consulting Group. I see a lot of familiar faces. I used to be in the Kansas world, so I'm excited to be back. But I want to make sure that we have as much time as possible, so I'm going to move it forward, and also you'll have a chance to meet some of my colleagues as well. So next slide. So we, as Melissa said, we are here to talk about the market rate study that is part of the CCDF requirements. We are privileged to be able to come to Kansas and help support this work. So today we're going to talk a little bit, give a little bit of background on PCG for those who maybe aren't familiar. We'll do a little review of the project team. You should have received the project scope and timeline prior to the meeting, so we didn't want to be able, we didn't want to have to dive too deep into all the nuts and bolts of that. But we'll give a little high overview of it, as well as the timeline, so you can kind of know what to expect. And then we're hoping to spend most of the meeting talking about, oh, thank you, Melissa, for some feedback, some initial discussion and conversation on the market rate survey that will be coming out. So next slide. Next slide. So as I said, we are part of the Public Consulting Group, otherwise known as PCG. We've been around since about 1986, and we're a leading public sector solution implementation orientations or operations improvement firm. We partner with health, education, and human service agencies to improve lives. Our team is part of the human services practice area. PCG's human practice service area is grouped with different centers of excellence, each comprised of experienced teams of professionals with practical experience in their given fields. PCG proposes that this work, well, we are leading this work with our early childhood center of excellence. So we have significant experience working with state early childhood systems on a variety of things. You can see on this map some of the different states that we've worked in and some of the different projects that we've done in those states. And so we've worked on market rate surveys, narrow cost analysis, financial and funding analysis, professional development and training, evaluation, systems change, policy development, planning, QRIS. It's a wide range of different projects that we've been able to work on with several different states. So next slide. This is just an overview of some of the different members of our team that are going to be working on this. Some of them are here today. I'll have them quickly introduce themselves in a minute. But you will likely get a chance to meet many of them throughout this process. But Ivy and I will likely be the main people that you will be interacting with more consistently. So I'm just going to have a few of them so you can put some names to faces. I know for me, that's always a nice thing. So Zane, if you are able to maybe do a quick little introduction.
Hi there. Yes, Zane Wyrick. Been a member of the Public Consulting Group for pushing 14 years, mainly focusing in child care market rate surveys and cost analyses, as well as early intervention. I was just in Wichita earlier this week, uh, working in working with your all's early intervention program. We're deploying a new data system that's going live next month. So my mind has been fully consumed with the state of Kansas for the past 18 months. So very pleased to have this additional work with you all. And it is quite smoky in Kansas right now. So forgive me for being a little bit hoarse. I learned that while I was there this week.
Thanks, Zane. Shelley, if you want to take a moment to introduce yourself.
Yeah, sure. My name's Shelley Ervase, and I've been with PCG for a little over 4 years. I work actually in the strategic purchasing department. So basically, yeah, it's kind of a very ambiguous title, but I'm a project manager, and I do a lot of work with cost modeling and rate setting. So very applicable to this work. And prior to PCG, I worked at Bright Horizons, which is a national provider of child care centers. So worked in their corporate offices. So and did some actual work on childcare and the cost of childcare when I was in grad school at Tufts prior to that. So really looking forward to this project and working with everyone. And then I think Ivy, you are.
Hi, yes, so happy to join you. Yes. My name is Ivy Doxley Martin. I'm a senior consultant at PCG and have been here for 5 years. Before that, I worked for Missouri Department of Social Services and Child Welfare for, I hate to say it, 18 years. So I've been in the early childhood and child welfare space for a long time. I am the project manager for this project. And recently I've worked on several market rate studies recently with Missouri, Rhode Island, and Wyoming. I'm so excited to be able to continue this work with Kansas. And I have also been recently visiting Kansas. I was in Wichita not long ago because I'm working with DCF on another project on the child welfare side. So I've just gotten to learn so much about Kansas. I love it, and so grateful to be able to learn more and deepen my relationships in this space.
Thanks, Ivy. Before I pass it back to Ivy, just a little bit of background on myself. I'm born and raised in Kansas native. I lived in Kansas for 23 years, most of my life, maybe longer. Nope, that was just in Lawrence. I was in Lawrence for 22 years. Before that, I was in Hutchinson. So I lived in Kansas for 40 years. I currently live in Golden, Colorado now. I have been working in early childhood for nearly 20 years. I've been at PCG for a little bit over a year and a half now. Prior to coming to PCG, I did work at the Department for Children and Families. I helped work with some of the quality initiatives where I maybe have gotten a chance to meet some of you, many of you. I helped on the helps with the implementation of links to quality, the QRIS system in Kansas, as well as doing a lot of systems work, especially with some of the COVID dollars. But I have loved being in early childhood, specifically in Kansas, so I'm especially excited to kind of come full circle and come back and get to work again in Kansas. I'm going to pass it back over to Ivy to go over our some of our project scope and timeline.
Sure. Thanks, Megan. And for sake of time, this is just a very simplified, high-level snapshot of the project scope. You have the nitty-gritty details in that project scope document that Megan referred you to. So when you review that document, if you have any questions, our contact information is available on this slide deck. So you can see there, though, obviously, market rate analysis involves asking questions and analyzing information provided by Child Care Aware of Kansas about rates and calculating at the minimum the 75th percentile for rates. We're going to be also looking at the way you have the rates grouped into 3 different cost areas, making recommendations around that, including recommendations around age groupings. So we're going to collect information from providers about how they defined their age groupings and the rates associated with that. We are going to be digging into the actual cost of providing childcare and comparing subsidy payments received to the cost of care. We're going to be looking at an array of provider characteristics, many that you see listed there, from accreditation status to participation in professional development and other quality initiatives. Also participation in the subsidy program, the Child Care Assistance Program, and any barriers to that. We are going to be looked at the cost of links to quality participation, enrollment fees, other fees charged, and really the crux is to collaborate with you and with DCF on our, just all along the way, from survey development to helping us provide context to our analysis and to our final report. So if you could go to the next slide, I'm just going to highlight a few things on the project timeline. And you also have this, you'll have this slide deck and you have this in the project scope document, but I did want to highlight a few things here. And so our goal for this time around is, which is what's different about our vision for this survey in 2026, is we would like to administer the survey for a minimum of 4 weeks. Last time around, the survey was administered for 2 weeks. And so based on our best practice, we recommend minimum 4 up to 8 weeks. And so to do that, we're going to be pounding the pavement to get our survey drafted so we can get our feedback, get it to you, and also get your feedback. Hoping for a launch in early May, maybe by May 4th. We also have offered listening sessions, so we want to work with you around that. Megan's going to talk a little more about that. Really to center some of our underrepresented voices. I want to point out that we are going to produce a draft final report by August 31st. So we're going to be asking for your feedback there. And then our final report is due October 31st of this year. So it's a pretty robust time frame. And so Megan's going to talk to you a little more about what it looks like to collaborate with you on the project.
Thanks, Ivy. If you could go maybe 2 more slides. So as Ivy explained, we are hoping to utilize this group to support some of our advisory group contributions, adding in an additional work group within this panel that can help support some of the initiatives or some of the parts of the project that Ivy went over. This is kind of a schedule, and again, that's in the project overview document. with some of the different focuses of the work group throughout the project at different stages of it and what we would be needing help and support with. And so really this group being able to provide some really key feedback, being able to be very focused on both their experience, either directly or indirectly with subsidy, with the Child Care Assistance Program in Kansas. And there might be some work needed prior to the meetings. I just want to be very clear on some of the expectations. This project is kind of moving very quickly. So there may be some either surveys or some different interactive whiteboards that might need some work in between some of those meetings. We don't plan on putting a ton of work or anything like that on the advisory group, just maybe some pre or prep work for the work group meeting. So with that being said, I want to make sure that we can try and have as much time as possible for the discussion. So Lindsay, if you would go to the next slide. So prior to the meeting, we are hoping you have been provided these questions ahead of time. So hopefully you've had a chance to kind of look through the documents that were provided to you and being able to develop some initial thoughts or feelings around some of these questions. And so we were going to take them one by one, but we thought that it might be more appropriate for the time to just kind of open it up to discussion. These are kind of our focus questions for them. However, we are going to also provide a post-meeting survey, which will also have these questions where you'll be able to provide some additional feedback. I know some people just need a little more time to process. Maybe some of the discussion prompts some additional thinking. But we want to be able to open this up. We're really looking at the last survey and what are some ways that we can build upon that, improve on it? How has the landscape changed since that one? And what are some different focus areas that maybe are more relevant to this survey versus the last one?
So Megan, I can kick us off. And one of the things that really came to mind is obviously we are a rural state, but we have high population in our urban areas. And what does that mean? Because cost of living in Atwood, Kansas may look very different than Wichita, Kansas. But resources may, they still may have the same similar resource challenges of home and rent and what that looks like. So, you all are the experts, so figuring that out, but that pops into mind really quickly. And then looking at, I love when you brought up links to quality, which is our quality initiative in the state. And what does that mean for all of that extra buy-in by the provider side to provide a different level of care that's challenging to them in a positive way. How does that translate into this? So those are two initial thoughts that come to my mind as you guys are digging deeper into what you need to explore.
Thank you, Melissa.
Tabitha, you had your hand up, and then Cornelia.
Yeah, I guess my mind is also just going to thinking about underrepresented voices, like families with children who have diagnosed disabilities or special needs. I'm thinking that their voices would be pretty important in this work. And I think, there are a list of organizations that we could give you guys of people who work directly with families. Who would have some insights there that would be important to share. I'm thinking like Families Together is one that's coming right on the top of my head, but I'm sure there are more. So that's one I wanted to offer.
Thank you. Yeah, I will say too, that's another thing with the advice, like the work group is and just in general, having some of those, identifying some of those key groups that we can reach out to and maybe even helping make some of those connections is going to be really helpful in this process. Thank you.
You're welcome. I just think that they really face different challenges when it comes to accessing childcare. And so that's where my mind was going.
And then I'm just going to remind, as I call on panel members, if you can introduce yourselves. I think as we get later on into the meeting, we get a little bit more complacent and comfortable with each other. So Tabitha, if you would share
Sure.
with the group who you are and where you represent.
Sure. I'm Tabitha Rossbroy, and I am the Early Childhood Project Coordinator for Kansas Parent Information Resource Center.
Perfect. Thank you. And Cornelia.
Cornelia Stevens, Executive Director of Top Early Learning Centers in Wichita. I spent a lot of time reviewing the cost narrow analysis in the document and paid a lot of attention to the reimbursement rate versus the various levels of quality that were presented. And there's this effort to push people, agencies, to either links to quality status or it mentioned like early Head Start or Head Start, but the document clearly showed a huge deficit that would happen, with programs, if they try to shift to quality. So for us, without having our block grant, for example, we wouldn't be able to, have the level of quality that we have because reimbursement rate isn't enough. And so I think that, if we're wanting to shift, which is a wonderful thing, to higher quality, some greater attention to the deficit that's presented, that would create to agencies to be able to fund and support the level of quality desired.
Thank you, Cornelia. Yeah.
Okay, transition to Desiree.
Desiree Straight. I'm a home family child care provider in Kingman, Kansas. I am nationally accredited and participant of Links to Quality. I also sit on our Child Care Provider Coalition for the state of Kansas, who represents the family child care providers. And I just mentioned some of those things because many of what subjects you are discussing with this, I deal with in my own program, but I also think sometimes home providers is that minority group that gets overlooked. And so I would love to be able to be a part of this and support you guys and bring that voice and share as well my experience and the experiences of other providers that I hear from. With that said, I would also like to just follow, like Cornelia said, that oftentimes everything that I do to become higher quality, I know my choice to do it is not because I'm going to get a financial gain. It's because the passion I have to bring that to the families and the community that I work with. So anyway, I would love to be a resource. So thank you.
Great. Thank you, Desiree. Yeah, I think having some FCC representation, I mean, we really want that diverse representation, and of course, including all the different sectors of childcare. Absolutely. Thank you.
I think Zane wanted to add to the conversation.
Yes, I just wanted to add, Desiree, thank you so much for chiming in. FCCs are such a critical part of the quilt that is childcare, especially in filling in times for non-traditional care times as well, in evenings and weekends, and a lot of the times centers aren't able to fill. Let alone there's so many families that prefer that type of care as well. So very happy to have you on board.
Thanks, Zane. I want to make sure that I'm being courteous of your guys' time. And I know this was just a really short discussion, but think of it as maybe like a little like taster, a little taste of what that advisory group could be and look like if you have interest. And like I said, Lindsay, if you could go to the next slide. We do want to offer, and we can send this out maybe post meeting to Melissa, but we want to be able to also offer a post survey with those same questions where you can provide some additional feedback. One of my colleagues always calls it the toothbrushing moment, like when you're like in the middle of doing this sort of mundane task and you have these like little epiphanies where you're like, oh, I wish I would have said that. Here's your opportunity, this little survey, to be able to complete and provide some additional feedback. If you want to provide even more feedback, please join the work group, the ad hoc work group for us. Next slide.
Can we pause on that really quick, Megan, and just really wanted to let the panel members know, as you mentioned, the ad hoc is that there, as I was scrolling through, I always like to scroll through, what panel members were able to join and maybe who had to drop off early or whatnot, and where we need to fill in the blanks. But your voice is valuable. Everybody on this panel has either, we've had an intersection with childcare at some point, even if we weren't parents. But if you ran a facility, if you even looking at Tammy, the library serves as an ad hoc childcare at some point, and everything that you do, and even Abdul thinking about his workforce this week and what's happening in their facility, and everybody has such a valuable voice that you may not know a lot about the rate, the subsidy rate, but understanding what is needed and needs to support childcare. So don't discount your voice in this conversation. And we'll look at for volunteers for the ad hoc group to really dig into some issues, but we will still have opportunities where the full panel will be able to react to any of the input given. So this is not a one and done session. It's going to be a continued conversation, because this is really the charge of the, as an advisory group, when we get statewide initiatives and making sure all the voices are heard. So I just want to put in a little plug for that. And I see Tammy, you came off mute, if you want to add to that.
Yeah, I was thinking about whenever you do something like this, you have to have a way to communicate those results to the public and get the public on board, right? And being able to be that voice, that community voice, and connect to community members who are outside the silo, if you will, of childcare or early childhood education. Is a way that I view us as a partner, and having input from the community on what they're thinking. So I can tell you, justification for the rate is something that that we hear conversations about a lot. Why do we have to pay so much for childcare? And so having those voices as part of this discussion, in whatever capacity, I think is also extremely valuable. So thank you for mentioning us, Melissa.
Yeah, and on that note, Megan and Ivy, we have a really good question that was placed into the chat. Is how do anybody on this panel want to be a part of that ad hoc group? I would say let Lindsay and I know first, and then we will, as one collective, pass that on to Ivy and Megan, and we'll look at what does that mean if for outside of the panel participation. But let's be collective. And Ivy and Megan, when would you like that list of names as we round out our morning?
That's a good question. I think probably by, and Ivy could jump in if you feel differently, but I think maybe by as soon as possible, by the end of next week, I think would be ideal. If people need a little more time, then I think that would be okay. But we want to make sure, like I said, the timeline's quick, and we want to make sure that we're engaging as soon as possible with those members. But yeah, I think probably by the end of next week, and I agree. I think, Melissa, you being the pass-through would probably be ideal because you already have that regular communication with them, and we'll have regular communication together as well. So
perfect. We will plan on that, and we'll set the timeline for April 3rd. and we'll go from there.
Perfect. Thank you so much. Yeah, so we look forward. I appreciate you allowing us this time. And we look forward to even more great discussion and conversations with all of you. So thank you so much.
Thank you. I think it's a very critical conversation in our state. So appreciate that DCF is taking on this charge and looking at how we can do it, really gather meaningful information. Okay, well, as we round out our morning, we're going to talk about our work group preparation for April. Because what we're going to ask in April is that we get some feedback. We have a check-in. We have what I'm going to call a warm check-in on your work group, and it's not anything formal. You can take it as formal as you want. You can, really just give a verbal, but we really want to know, and you share as your work group with the rest of your panel members is what is your work group exploring? Any aha moments in your work group so far? Unforeseen barriers. And then what can your peers in the panel support you in your curiosity? And then we're really wanting to set the tone for our June, final share out as our last meeting that we have together. And when we look at it, last year that was the first meeting I was able to join with the panel. And it was great to have these very formal presentations and see all of the hard work that you have, you invested in over the last year. But we're really going to leave it up to you. Been inspired by my future fellow participation, and really want you all to define what you want to share in June as your final share out. Really leaving us in the idea of, do you see your work moving forward with the 26-27 panel? Do you feel like you've summed up? Because remember, we're not really, if you go back to where we had some of our early conversations about your work group, it's great to have a recommendation, but it's not needed. Really, this is an exploratory of ideas that you may want to share forward without a formal recommendation, and that's just as valuable also. But maybe it's an artifact that you want to share with the next, as part of your work with this panel. Maybe it's an illustration. We want you all to be as creative as possible in your June share out, and really define how you want to do that. Maybe it's a video you guys create together. I don't know, but we're really going to challenge you to leave that lasting impression in June. But June's going to come here pretty quick, so we wanted to really plant those seeds now. And then again in April, that's going to be part of our group. In April, we will be hosting the state home visiting leadership team, because that was an ask of the panel to really dig deeper into home visiting. And then the last part of the meeting will be you guys sharing out as a work group with that warm check-in. So planting that seed before you all meet today. Lindsay, the next slide, please. Okay, we're going to briefly go through some systems updates. Next slide. Just wanted to remind you of some statewide opportunities. We have the CAME conference, really focusing on, I love resilience. I think it really plays well into the theme that we were talking about today. And on that same theme, also the care and wellness conferences. These are really family-driven connections. This is a free event that brings together Kansas early childhood professionals, mental health providers, and families to focus on mental health and special healthcare needs. They will be in Wichita, Salina, and Olathe coming up in May, and really wanted to share that out. We will share the flyer, but also wanted to make sure you had the registration link if you wanted to share that out through your network. um, in the areas that they are offered. And then lastly, if we can move to the next slide. Okay, key takeaways. That was the promise that we would have. And the key takeaways for me as your chair is the value of a lived expert. I have been participating in the CanLink since my tenure with the Children's Cabinet started last May. And I just love the work of the lived experts because we all come to our seat with, you know, with our bookwork, I want to say, you know, with our lens of this is what my degree's in, this is where I've spent my time. But the lived expert really helps to challenge the system to be better because they help us stay grounded in a real human experiences. And when I've joined CanLink meetings and I've heard the voice of the lived experts, you know, not that I don't love Jenny and Megan, but I'm possibly more moved by that lived experts conversation than I am an expert in the field because they have been there and they have experienced it. And they ensure that our work is connected to the people it's meant to serve. So I actually wrote this last night. So love that that really came full circle in the CanLink conversation. And then when I was looking at the K-pop and really our market analysis, that those social connectedness so that we can do better for Kansans in our states. And we can only do that by getting out and talking to our neighbors, knowing those that live in our communities and having those social connections. Being seen and understand is a core tenet for all human beings. And it reminds us we are part of something larger, like the work and makeup of this panel. And I'm going to share just a really simple lesson that I learned. We have a young family that lives next door and love the voice of the 2-year-old who's playing in his backyard. And I wanted him to know that I see him and that I understand, and created a little bug garden in the corner of our shared space so that he can come over and look at the bugs and he feels connected. And I love when his mom says, you know, that is the neighbor that, you know, and reintroduces me all the time and says, and he says, oh yeah, you live by the big tree. And the big tree is actually in my yard. But he doesn't see that it's in my yard. He just sees that it's a blend space and that that tree is, you know, for both of us. And his bugs are for both of us. And so, you know, I take time to know my neighbors. And I think of what we learned today is the same in all of the work within K-pop and within CanLink and in the market analysis is that we are making those connections to know our Kansas neighbors better. And those were my key takeaways today. And I'm kind of getting a little emotional thinking about it because it was just a very great meeting. And that being said, those were the lessons learned that that I took away for today that I felt were valuable to the panel members. And Lindsay, if we want to go to the next one. So that being said, anybody on live stream and anybody that is a part of the panel this year, we are coming up on our panel applications for the 2026-2027 year. And those will go live after our formal cabinet meeting next Friday, April 3rd. And we will have a live link that we'll share out on the Children's Cabinet website and to our current panel members. We have spent some time to be intentional about and updated our application, just tweaked it just a little bit to really have some questions that are thought-provoking of why you want to be a panel member and what the panel can be of value to you in your, you know, wherever you sit in this early childhood ecosystem. So Lindsay will make sure that Lindsay and I will make sure that we make sure you have the link to that live application next Friday. And then just a reminder of upcoming meetings. Children's Cabinet and Trust Fund will have their meeting next Friday, April 3rd, and you're more than welcome to join the live stream. And then our upcoming panel meetings will be April 17th, May 14th. And a reminder, May 14th is the third Thursday, which you guys were so gracious so that I can attend graduation for a family member, and appreciate that. And then June 26th will be the fourth Friday, so a little bit outside of our cadence. And with that being said, I thank everybody for their participation. It is always a pleasure to serve as your chair, and love the conversation and the content that we can have. And for that, we're going to adjourn for the day and give you plenty of time to get into your work groups. So thank you. And Lindsay, if you want to stop the live stream and recording, and we'll do the housekeeping for our work groups.